For those of you who weren't here this morning, my name is Sebastian Köhn. I'm the Director of Sexual and Reproductive Health and Rights at the Open Society Foundations, which is one of the financial supporters of the summit. I'm personally very excited about this last session, so it's great to see that there's still so many of you in the room, even though it's late in the afternoon. At OSF, in our SRHR program, we focus specifically on trans health and sex worker health, and that's sort of the topics of the presentations in this last session. I think what's been interesting for me as a cisgender gay man who relocated to New York or to the US in 2010 and started on PrEP pretty early in 2013 and had a very sort of liberating experience with my own use of PrEP, and at the same time through my work, primarily at the time with sex worker groups, but increasingly also with trans organizations that we support, I felt like there was an entirely different conversation happening in those communities. So I'm really happy that we have this session, and I will just introduce the first speaker, which is Josina Calliste.
Good afternoon, everyone. Me again. I'm Josina. I'm the project lead for MobPrESH, which is part of my role as the strategic lead for women and PrEP at PrEPster. I'm just going to do that. Is that better? I've been running this project for about 10 months now, and what it was developed by was what we know about the challenges for women around PrEP, and that we needed to address low awareness, uptake, and demand by women. And there'd been other efforts around women and PrEP, and we're still trying to find out what works. So although Will was not super keen on innovation, this was appropriate to be an innovation-funded project in England. So what we know is that peer-led approaches are acceptable by women for receiving health information, and for other groups, such as MSM, receiving information by peers around PrEP, we know that that works and that's acceptable. So all women and people who are working on PrEP and women know that it's necessary to integrate PrEP with other reproductive and sexual health concerns, and HIV prevention can be a low priority. So for trans women, concerns may be around hormone replacement therapy and PrEP and in the interaction there, that's quite well known. And for cis women, pregnancy is often a much higher concern. So MobPrESH is mobilizing for PrEP and sexual health. It's a peer mobilization project that ran in 3 regions of England. So it was 3 organizations working in partnership. So Bristol and the Southwest, there was an organisation we worked in partnership with there. London, I was running the project, and that was PrEPster. And in North Yorkshire, we worked with another organisation, Yorkshire MESMAC. And it's open to all self-identifying women. It was really important for all of us that we had a project that was not separate. So it's a bit confusing in terms of programming, because I've just been speaking about on a panel about cis women. And now this is a section that's more about trans people, but that it was a project that trans women felt safe enough to join in on, and that we had peer mobilizers that were trans and were able to reach into communities that we'd not worked with as much across different groups of women. So the focus is on involving women from communities that are most affected by HIV, and that was reflected through the recruitment process and in the training materials, that it was tailored to these women's needs. So the project involved and represented trans women, Black and other women of colour, and migrants, and we had a wide array of languages that were spoken by the peer mobilisers in the project. So we recruited through PrEPster's extensive social media and personal networks in sexual health. I'm involved in an organisation called Decolonizing Contraception, which involves a lot of sexual health professionals that are also women of colour. And the communities that, that we had people that self-selected to become peer mobilizers came from Black Caribbean and Black African backgrounds. And when I say Black African, it wasn't just one country, it really was all across Africa that people were represented. So Somali women, South African, Zambian, Nigerian, and I think that was a real strength of the project, that we weren't thinking about African women as a monolith. Asian women as well as white British. And people belonged to different peer groups. So we were able to work in education settings, faith groups, workspaces, and other groups that people belong to, like a film club, theatre groups, queer women's spaces. And the project was inclusive of women who are living with HIV, and it was really important for women who weren't living with HIV to learn from women who were and their experiences, and share information, and also that there is a younger groups of women who have no idea about the context that someone who was diagnosed in the 80s, that what their stories were. And I'll proceed. In terms of the training, we started from the basis of HIV and their relationships to key populations, and it really was centered, Black women were the starting point, which was quite rare for training materials around sexual health. And it covered PrEP use, the tricky details around the impact trial and whether people can, how easy it is, what gatekeepers are involved if women are trying to access PrEP. As you may know or have been given things by PrEPster, we do love making merchandise, and so part of the training was setting a challenge to participants to find out creative ways to distribute the t-shirts, stickers, various bits of merchandise, and find different places where they can put it or ways to talk about it. The training covered more traditional concerns of women in terms of STIs. PrEPster's made a bunch of videos that are relevant to trans populations, so those were included. Contraception and pregnancy, consent and relationships are really important to talk about when you're delivering PrEP work with women. We also had creative facilitators come in to help deliver the workshops. And so we did an array of things like collage making, writing, poetry, photography, meme making, and that gave participants an opportunity to put their learnings into practice and think about how to take what they've learned about PrEP back to their communities. And we've done loads of activities with different peer mobilizers. In particular, carnivals and prides in 3 different cities, which meant that we had a really busy summer. And that gave us a wide reach to women in communities that were relevant to the project. We were giving out zines and booklets that were written by women of colour and included women PrEP users' voices in those materials. We did a banner making session with queer and trans youth and the peer mobilisers in London, and that was in advance of London Trans Pride. And that was a really beautiful opportunity for people to exchange information between the youth group and the peer mobilisers. One woman in particular, she was involved in the Muslim Forum of Britain, and she spoke to over 40 women in one particular meeting of this forum, and that was women everywhere from Pakistan to Nigeria, and I'm really proud of her confidence and reach into communities, and she'd organised that of her own initiative. So the reach of over 19 trained peer mobilisers into new communities has been wonderful to see unfold. We have one more training coming up, so it's not the total number of people trained. But it really allowed PrEP messaging into new communities and developed peer mobilisers as leaders in their communities. And the organisations that have been in the partnership of the project have a new capacity to deliver PrEP education, especially to these new audiences of women. And we're now building the next generation of PrEP educators and activists. And the new PrEPsperts have had training which was inclusive of sex workers, trans people, migrants, lots of groups that maybe hadn't worked together before. And there was some concern that there might be pushback between different communities, that maybe trans people couldn't work in the same room as Muslim people. And then we had queer Muslims that were involved in the project, and there was none of that pushback in the training and in the delivery. And so for the first time in my sexual health career, I was able to deliver a training that was centered around Black women's sexual health needs and that was inclusive of so many other groups of women. And one of the key learnings from the project was that people will come to the training if you show that you're on the side of the people that you work with and that you care about other aspects of their lives, like making sure that childcare was available, childcare expenses, and that you're thinking about the other aspects of their lives and how that will impact on their sexual health. So that's all. Thank you.